turning on everything?
Yes, for sure. All right. All set.
Perfect. Okay, let's open up and we'll see how we go. Hello, hello. Welcome, everyone. Welcome to this Friday Forum. Glad to see you all joining us. We're now live streaming, so if anyone misses this link, you can also go to YouTube. Hello, 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 everyone. This is our Friday Forum. This is the first Friday Forum of 2024. And we are very, very excited to introduce the topic today and to talk to you all about this wonderful panel of people and with all of you. We are focusing on how to best provide social protection and what mechanisms do private providers tap into to support their TB patients. We had our first webinar last week when we talked about quality of TB care, and we specifically looked at some of the methods around standardized patients. And as part of that, it also came up that the care is often substandard. And part of that care is the social protection that someone that goes through a journey of treatment of tuberculosis really needs much more than only the treatment. So that's the topic that we are talking about today. And in this Friday Forum, we explore with a wonderful group of people. We have three fantastic people that have gone through TB treatment. We have Carol from Kenya, who is an activist, very vocal, also on various social media platforms, and she is gonna help us talk about her journey in Kenya. We have Kiri Vanushali, who has gone through TB treatment in India, and she has, again, also a strong advocacy voice as a writer, and she's gonna share some of her words today. And Funke from Nigeria, who is now working with Stop TB Nigeria, coordinating efforts in North Nigeria. Congratulations on that new role, Funke. And Funke has also gone through TB treatment in Nigeria. And with her health education background, she brings two perspectives to this panel. So that's going to be really interesting to hear. And I'm very pleased that we have also the perspective from providers. Dr. Devabrata Sinha works with World Health Partners in India, and he works as a private provider actually with people that are going through TB treatment. So I'm looking forward to hearing from his frontline experiences. Dr. Prabha Mahesh is working for TB Alert. She coordinates the efforts of a large group of various private providers and public providers, but also private providers, has 20 years of experience in India, and we'll talk about programming and also the frontline experiences. And then we have Afshan Isani from Pakistan, who works as an advisor to TB programs and has been focusing on the aspect of engaging private providers as well. And we'd love to hear from her experiences from Pakistan. And finally, we also have two colleagues from WHO joining us, Ernesto Jaramillo and Delia Bocchia, who are both working on the area of social protection, have done an incredible amount of work in collecting information, guiding research, guiding the overall topic of social protection. And we can't wait to hear their insights on this topic. And finally, last but not least, I have the honor of introducing Blessy Kumar, who is going to take on the task to moderate this forum. Blessy, you all know, I don't think I have to introduce Blessy, but she leads GCTA in India, is a frontline person for all of us in big political discussions, in the task force of WHO on affected communities. She speaks to the UN high-level missions and to everyone else. So Blessy, thank you so much for taking on this topic and joining us. For the audience, a few quick logistical points. Please use the chat or raise your hand. We're very pleased that this is a popular topic so that many of you are joining. But let's keep ourselves muted so that we can make sure we hear from everyone. The session is being recorded and live streamed on YouTube, so you can also look back afterwards. You can turn on the subtitles for your own use if you need to. And we will be sharing a news post beginning next week on our website, where you will see lots of the quotes and the key messages. Please join the TBPPM Learning Network if you have not, because then you will automatically receive all of the updates. So with that, I would now like to hand over to Blessy so that she can moderate the first question and take us during the whole debate from here. Blessy, please go ahead.
Thank you very much, Petra, and it's wonderful to see so many people actually interested in two topics, PPM, first of all, and secondly, the social protection part of it. So I just have two things to say. One is PPM is public-private mix. It's a combination of both. And the intention is that a person who is seeking care needs to get the highest quality of care, irrespective of where the person seeks care, whether it is in the private or in the public. That is the bottom line. And the second point I want to make is that social protection is non-negotiable. In my experience of having dealt with, spoken to, lived with thousands of people who've gone through the TB journey, including myself, social protection is an area that really gets so little attention, especially in TB. I think we have medicalized TB to a large extent, which I'm happy to say is changing in the past few years, but the human aspect of it, do I have food when I take those medicines? Do I have money to pay for my transport? Are my needs being met as I go through this really difficult journey? Are questions that the survivors have been asking for years, and it's only in the recent past that we have actually got some guidelines, some direction into which we have to, take the TB response. WHO talked about catastrophic costs, zero out-of-pocket expenses. We haven't reached there yet. Even today, patients have to pay a lot from their own pockets to ensure that the treatment is continuous. There are stories of people having to sell their land, having to sell their homes to get the treatment that is needed, and that is definitely a violation of every right possible in the human rights sector. So we need nutrition support, transport support, financial support for other things as well, peer support. You want to be able to talk to people like you, who have experienced this. And we need to have access to mental health, which is a huge issue, and not enough attention has been given to that. Understand what TB is, have access to people who we can talk to. So those are just the 2 points I wanted to raise. Social protection is non-negotiable. It has to be right alongside the diagnostics and the drugs. So with that, I'm really excited to have our speakers that Petra has already introduced. So first, I'm going to call on Carol, Funke, and Kiyuri to share with us their journeys. And I have heard them before. I have heard at least 2 of them before, and they bring a perspective that should really highlight what we are here to talk about today. So Carol, over to you first. Thank you.
Hello, Blessy. Thank you so much. I'll start a bit by talking about my journey. So when I was diagnosed with TB, it was like a whole new world to me. I mean, I didn't know much about TB, and the only knowledge I had was like the one I got from my low-level education, just knowing about the symptoms. So when I was diagnosed with TB, I had to like find more information on my own. I had to Google, I had to research to know this is TB, this is what it looks like. So I got most of my information by doing my own research. So in the process of doing my research, I learned what TB is. I learned how less TB is talked about. And then I learned about the myths, the misconceptions, everything people talk about TB. And then when I looked at how people with TB are being affected by stigma, you know, from all the myths that people, that there is all the myths that are about TB, I didn't want to talk about it because one, I did not want to experience the same. I didn't want people to judge me. I didn't want to be shunned. Fear that I was going to infect the others, because in the place of research, I learned that if I was infectious, then I could infect those people around me. And I also knew that there are others who knew that if I had TB, if I was coughing all the time, that I was going to infect. So that was one of the main reasons I didn't want to talk. I didn't talk about it, and I kept it to myself. So when it comes to social protection, I'd say in my TB journey, I'll like explain it in two ways. I received this in two ways. So I first of all got nutrition support. So in the facility that I was going to get my medication, in the TB department, they used to offer me these packets of, packets I was supposed to go and make some porridge. At that time, I didn't much weight. So every time I would go in, they would like wait, telling me this is too low. Of course, I'd lost a lot. So they tell me, kindly make sure go take this. I know you're not able to take in a lot of it, but try to take this. Every time I go for a visit, like after a week, after 2 weeks, I'll still get all these packets. And then I can say that really helped me. And then another thing that helped me was peer support. Like that really helped me. So when I finished my treatment for the 6 months treatment, and I felt like I had not recovered mentally, and I wanted to connect with people who had the same experience as me. So what I did is I went on Facebook, started looking at TB in Kenya, support groups that I can get, and then that is when I discovered Stop TB Kenya, who connected me to the network of TB champions. And they were so supportive. Like they just added me to this WhatsApp group, and then there was a lot of that. I think at that time there was around 250 participants, and they were talking about experiences. They were freely talking about TB, and I feel like this really helped me because I was like, these are my people. These are people that are talking about experiences. I can talk about it also. So I like when I joined the group, first did is introduce myself, talk about my story, and then they encouraged me to keep talking about it. Honestly, that is why I got the courage to keep talking about TB and sharing my experiences and all that. So I say the nutritional support really helped me, and also the peer support was very important to me. It helped me like cope with the mental consequences of the disease. Over to you, Blessing.
Thank you very much, Carol. That was very powerful. And even though I've heard your story before, it always hits me how little information was out there when you got TB, and how you proactively, searched and got that. So thank you very much for that. Next, I'll call on Funke. If you can, share a little bit about your own journey and how social protection played a part in it, and why, tell the audience today why it is important. Why are we talking about it today? Thank you. Over to you, Funke. We can't hear you. We can't hear you. Can you? Is it just me? Can other people hear her? No.
No.
Okay.
No.
Maybe go first to Curie, and then Funke will give
Okay.
you a space to look at your audio.
Okay, curious, the same question for you as well. Just share a little bit about your journey and just establish for the audience here how important social protection is, even if you're seeking care from the private sector.
Actually, can you hear me? Yeah.
Yes.
Actually,
Yes,
I
thank
got cured of TB in 2011. Like it took me overall 3 years to get rid of this disease. 1 year went in wrong treatment, and the other 2 years went in right treatment. So this is the same old story, like late diagnosis, wrong treatment, and then I got right treatment. Now, from my journey, I realized that when we talk about social protection, we should not even think about social protection as something which you give to TB patient as as perk or as kind of a bonus. It should be like part of the regime. It should be part of the treatment. Like it should be given to the TB patient when they are on that TB treatment itself. When I had TB at that time, I received a good medical support, great family support, and yeah, financial support and all was great. Like from my family, I received financial support. But about the information, like what is TB, there is called treatment. You fail treatment, like all this thing. I was completely oblivious. I was not even aware of treatment failure word, and. Yes, while we treat TB patients, social protection really plays a major role, because I personally feel that this social protection forms the ground on which your TB treatment can stand tall. So if the ground is shaky, your treatment, medical treatment will fall apart, and we don't want that to happen. So we should always remember that while you are giving medical treatment to a TB person, you are not treating just the disease, you are treating person. So you should focus on the holistic well-being of the patient, not just of think about curing the patient. So social protection in the form of like information sharing, mental health services, and other helplines. Like immediately if a patient wants to talk to somebody, there should be somebody available, there should be some system in place. Because we are very much afraid while we are in treatment, because we all face different kind of side effects. Like few days back, there was one patient who reached me out on Gmail, on through Instagram. That girl messaged me that my complexion has, like I'm dark in complexion, and I'm worried about that, what will happen to it. So like of course, if we say these things to some anybody, then they'll say, okay, you should worry about your life and not all this thing. But all these things also matters. Like we need somebody who answer our this kind of questions. So that's it. So that's it from my end. Yeah.
Yeah, thank you very much. You again bring the importance of social protection, but also awareness why it's so important. Let's see if Puke is able to speak
Okay,
now,
can you hear
and
me,
if we
ma'am?
can hear.
Can you hear me
Yes,
now?
yes, yes, I
Oh,
can hear
great.
you.
Okay.
Thank you.
Good
Go
afternoon,
ahead.
everyone. Good afternoon. Okay. I'm so glad to be part of this meeting. As we all know, I'm a survivor, and from Nigeria. I survived TB 2015, and since then I've been a global advocate for TB. And I'm here to emphasize on the need, the role, the critical role of social support in the treatment and recovery journey of TB patients. My journey was a kind of an emotional one. Basically, I didn't get to hear about TB on the radio or anywhere, and I had to just find a way to get my treatment. So I googled about TB on the internet, and I saw the signs and symptoms that could have, come up with TB. So I had to rush to the clinic for, checkup, and it was TB. I felt so bad because it was like my life is ending. So, but it's not a life sentence. So, but all I got was my family support. Yeah, I had a family support from my mom. She was so dear to me at the period, and it wasn't funny because during my treatment, I didn't get any counseling from any medical health worker. I had to find a way to get the information myself. So, and we can also attest on how social supports positively impact mental health, treatment adherence. So from the adherence part of my story, my mom was always on my trail, like, take your drugs, you're not gonna die, we need you here, and all that. So, and throughout my TB journey, social protection played a vital role in my recovery and well-being. This support came in various forms: emotional support, because I have a daughter then, and I need to be there for my daughter, but I couldn't So, but my family was all I could rely on, and the psychosocial support I got, I was already losing my thumbs. I couldn't even hold my pen to write anything. So that's for me, because as an health educator and as a writer, I couldn't hold my pen to just do anything. So I wasn't feeling happy. So, and unfortunately, counseling and follow-up was very bad from the health clinical aspect of it. They were supposed to counsel, tell me how the drug was going to react on my system, but I didn't get all that. So I was so scared that I'm going to lose my life and, my family. So there was this gap of counseling, which is very, very bad and needs to be strengthened way forward. If some of this social supports could be available to help alleviate some of these challenges faced by the treatment and recovery of TB patients moving forward. Financial support, no, I didn't get any financial support, but during my treatment journey, my family was all I had. And here I am today as an advocate. I couldn't stop talking about TB because I lost my job. My job wasn't waiting for me at the end of the day. So, but I had to look for an advocacy organization that could help me with my vast knowledge on health. And I was able to move with the national TB program and some of the NGOs around Nigeria that could help me, put me in the space to speak about TB because I was so passionate about it. And this has also built my capacity in areas where I could mobilize other TB survivors like me. So to encourage and give them that confidence. Yeah, thank you very much.
Thank you so much for that. So that was great to hear from all three of you, and strongly raised the point about support for mental health and awareness about TB, and definitely, financial support. So we'll move on to the next section, and here I want to call Devabrata, Afshan, and Prabha, who are actually directly involved with providing care. And the question for you is that in your experience of care and support to people with TB, what are some of the ways in which you provide social protection across the care cascade or the patient pathway? And some of the, if there have been any innovations in the last few years, please do highlight them. You have about 2 minutes each. So over to you. I'll call on Devabrata first. Okay. Afshan, maybe you can go ahead in interest of time.
Can you hear me?
Yeah.
Can you hear me, ma'am?
Yes, Devabrata, please go ahead.
Okay. Thank you for giving me opportunity to speak on this. Tuberculosis, ma'am, itself is a vast subject, and in India we have been dealing in this. My personal view on this is, as a doctor, is for a TB patient, it is most important to relieve him from stigma and myth related to TB. As a medical professional, my foremost duty is to provide right guidance to the patient and enroll him to right treatment process. Now, regarding social protection in India, our government and Honorable Prime Minister is committed for regarding TB to eliminate through programs. The focus is on early detection, contact tracing, and TB prevention treatment, free treatment and diagnostics, nutritional support under NPY, Nikshaya Poshan Yojana, in which 500 rupees per month is directly transferred to the patient's bank account, and regarding for his treatment and nutrition purposes, access to treatment coordination to provide counseling and follow-up visits, community engagements to provide social and emotional support to TB patient and social integration to reduce stigma and discrimination. This is the most important, ma'am. Thank you.
Thank you very much. And just a note to the audience, please do feel free to put your questions in the chat or in the, and we'll pick them up when we come back. Over to you, Prabha.
Good evening. It is indeed a very fortunate opportunity for me because here I come with many hats, being a survivor myself and a TB advocate, and presently I'm a director with this organization, Alert India. We have been implementing TB programs, control programs. So as far as social protection goes, see, I had another colleague who explained it, okay, as per the directives. So there are these advantages, like we do have NPY. There are benefits for the TB patients. But what is very important here is how do we reduce the out-of-pocket expenditure of the TB patients? Though the diagnostics and drugs are free, but the entire journey encompasses a lot of milestones where the patient requires help. So as an innovation, what we did from our organization, so the Gene Expert is the actual diagnostic test, which is given free. But prior to that, the patients are required to do a chest X-ray. So this chest X-ray is totally given free of charge, where we get it reimbursed. And these are in the private labs where the patient is given a free coupon. That's a voucher. The patient takes the voucher and goes to the nearest private lab, irrespective of the cost, whatever the lab charges are. So he or she gets the test done. And after the test is done, we reimburse as a part of the organization, we reimburse that money to the labs. So that is one, cutting out the out-of-pocket expenditure. Another, I would say, an initiative at a personal level, which we have taken from the organization. Unfortunately, though they are going to the private medical practitioners, unfortunately, when a person is really, not in a position, unaffordable category, they cannot pay the consultancy fees. The consultancy fees of private providers ranges from something like 500 to 2,500 rupees. And even if they're getting the rest of the services free of cost, every time they need to meet the private practitioner, they have to pay the cost. So we try and give references to the closest private practitioners who do not charge much for the patient. This is in terms of economic help, which we do. As far as nutrition is concerned, like our friend said, government does give the direct benefit transfer, the DBT, to TB patients. And the saddest part of it, you need to first call the patient, collect the bank details, and then only they get that money. Imagine in a country like India, how many of them do have their own bank accounts? So they do not have their bank accounts, and probably it is a too personalized thing that they do not want to share the details. So in this case, we try and seek the coordination from the private provider, because they believe and trust in the private providers. Through them, we try and get information. I'll just tell you recently, but that comes with a cost. Like, we have appointed exclusively calling people for calling, directly talking, because quality is most important. Even when you're talking to the TB patient, it cannot be on it cannot be just like reaching out to a patient just because we need to get the details. So through the calling, I'm just giving you an example. Out of 250 odd patients who refuse to give bank details, just by this quality calling, we could retrieve 137 TB patients who agreed, who understood why they need to give this, so that we could give this, make this incentive possible for the TB patients. Apart from that, we have identified CSR. Even this afternoon, we had an event where we had identified a CSR who could give this nutrition actually kits to the TB patients, because that 500 rupees that they get, they cannot. In India, you live with your entire family, and it's not possible that the mother will, the person, TB patient will take it exclusively for them, consume it for them. So we had even distributed actual nutrition kits to the TB patients, so that their nutrition needs are taken care of. But that's not enough. And also we have, as we all discussed about mental health, so we have these helplines. We have these people who can be contacted at any time by the TB patient if they want to ask their innermost or the most personal discussions or anything related to their journey, whatever they wanted to share, they can. So we have reached out to 67,000 odd TB patients, and each month at least I get 3,500 plus confirmed TB patients. And it's a huge population. Again, limited resources are very, very limited. We cannot provide, as you said, even the nutrition I could give only for 50 patients. I cannot give for more patients, but definitely social protection, just not economic. We have also innovated a bit on the income generation, in the sense people have lost job. We have gone and met the employers, not in all cases, sorry, but few persons, we have helped them getting back employment. Thank you so much.
Thank you very much, Prabha. Over to Afshan.
Thank you, Blessy, and what a fantastic forum and deliberations. And I completely agree, and I echo with Prabha. Yes, absolutely. In Pakistan as well, the current programs, be it the public sector or the private sector, all the diagnostic and the treatment modalities and services are provided free of cost. And if we're looking at the general practitioner model or even the private practitioner that are associated and working closely with the programs, all the services, be it the diagnostics in the form of expert, microscopy, and even culture, they are provided under the overarching program, National TB Control Program. All these services are free of cost for all the patients. Coming to the nutritional support, and I completely agree with Blessy when she said that, you know, it's the social support is something that is non-negotiable at every level. So yes, absolutely. For the nutritional support, currently we are struggling. And we have one thing that is only for the DRTB patients. Currently, we are providing them social support in the form of around $45 to $50 per month, which not only covers their transport, but also covers their little bit support them with the nutritional support. Other than that, absolutely, there's a dire need. And as we also know that as per the NTB strategies pillars, the social protection, the poverty alleviation and actions, they are very important pillars which needs to be addressed in a more pragmatic and a holistic manner. And one thing that I would also share, that in Pakistan, we also have two other programs. One is the Benazir Income Support, BISP, and the other social support is the Conditional Cash Transfer, which is a Sehat Sahulat program. But because of the modality of these two programs, because they run in the different provinces, so all the TB patients can be connected to them, and that can be provided and give relief to the patients when it comes to the social protection. So currently, as I said, that it is not in every province, not across the board. So, but that can be a very useful platform, which if used in a proper manner, can support the TB patients in a more support them in a financial way, and also help them complete their treatment as well, without giving them any, without them having to bear any catastrophic costs in terms of TB, suffering from TB disease. So yes, thank you very much.
Thank you so much, Afshan. It was great to hear from people who are actually caring for people with TB and the importance that is given to this. And next we move to slightly policy level question. We have two colleagues, Ernesto and Delia. And the question to you is that to share with our audience a little bit about the social protection policy from WHO for people with TB along the patient pathway. And also, how do you ensure or encourage that this becomes a reality on the ground? What do you expect the providers to do? And ultimately, what is the goal of what do you hope to achieve through this? Thank you. First, I'll go to Ernesto.
Okay, thank you, Blessy, and thank you, Petra and colleagues, for organizing this. I mean, let me begin by the basics and what we all know. We all know that poverty and social determinants are the drivers of the TB epidemic, and that is well known for more than a century. More recent evidence showed that not only poverty drives TB, but TB amplifies poverty. So how to break this vicious circle? The NTB strategy was quite progressive in 2014 by presenting social protection and poverty alleviation as a component of the NTB strategy. And just to repeat the language that Blessy is using, it's a non-negotiable component. It's not that, well, if you have time, if you have funds, if you have money, if you have politics. No, it's as important as the diagnosis and treatment. However, it's very well known at all levels how powerless we all feel for tackling poverty and social determinants. And here is where we need to take a reality check and understand and accept that virtually every country has a department or a ministry responsible for social protection, which is a human right. So we are talking about access to health as a human right. Where are my medicines? Where is my gene expert? Of course, it's a human right. You need to ask for it. But nobody is asking, where is my social protection? Many of us who were in Paris at the union meeting last November were delighted to see the civil society asking, where is the protection of my human right to health? However, nobody was asking, where is my human right to social protection? And here is when we have an opportunity now, not only with the inclusion of social protection in the NTB strategy, but with two important recent developments. Heads of state at the United Nations General Assembly issue a political declaration in which they commit to ensure no more financial economic hardship for people affected by TB by ensuring that all people with TB has access to social protection benefits that can eliminate those catastrophic costs. And the other important milestone is that hopefully on World TB Day, we will be launching the first ever guidance explaining, advising countries on how to ensure that social protection covers the needs of people affected by TB. And this is a very peculiar guidance document, unlike many others that we produce in the Global TB Department in Geneva. Is jointly produced with the International Labour Organization. And this in itself speaks volumes about the commitment of two UN agencies that can complement each other in the mandate they have. So I would like to invite my colleague, Delia Bocha, who has been, with many others, a pioneer for more than 10 years in making possible that social protection now is part of the NTB strategy. And she will share with us, just to be sure we are in the same page, the basic concepts around what is social protection, what is a human right, why it matters so much for ending the TB strategy, for ending the TB epidemic, but also for ensuring that no more poverty is created as a result of TB. Over to you, Delia.
Thank you very much, Ernesto. If Blessy allow me, I would like to share just a couple of slides, just for the sake of showing the cover of the incoming WHO ILO guidance on social protection for people with TB.
Sure.
Ernesto, can you see my screen?
Yes, we can, Delia. Thank you.
Yeah. So Ernesto has very eloquently described the importance of the social determinants of TB and the impoverishment effect of tuberculosis. I spent best part of my career working on the impact of social protection on the social and structural determinants of TB, and also on the some important TB outcomes. And there is an overwhelming amount of evidence that show that social protection can break the link between TB and poverty. And there is a growing body of evidence, of convincing evidence, showing that social protection can have a significant impact on TB incidence, treatment outcomes, and catastrophic cost. I'm not going to enter the details of that, but from what concern the impact of these interventions, I think we are completely covered. And I think that, of course, there's still research to do, but we know enough to make a strong case for the inclusion of social protection as part of the programmatic response of countries to tuberculosis. And of course, now there is this obligation because of the latest and the new target of the UNGA resolution. One important thing to say is that while we know very well the impact of social protection, there is a much wider gap, knowledge gap, when it comes to how to translate this knowledge into programmatic action, how the knowledge, the notions that we gather from research projects can be translated into programmatic actions from countries. And countries, I mean, the lack of knowledge, a lot of people until now have mentioned the lack of knowledge and awareness, but there is a lack of knowledge and awareness even among TB officers, staff of the NTPs, social protection officers, and the reciprocal understanding of how to work together and how to deliver effective social protection interventions for people with TB. In order to fill this gap, WHO and ILO gathered together and they put together the first guidance on social protection for people with TB, which has the precise intent to support countries in the planning and implementation of social protection programs. The guidance has three main goals. One is formative, in order to address all the knowledge gaps in terms of notions, definitions about social protection, implementation strategies. The second goal is to support countries in understanding how do they plan, how do they design effective, inclusive social protection programs, and finally, how they implement these strategies. And I'm going to finish by saying that the guidance has goes into the details, and I'm not going to enter them right now, but it does offer a very broad menu of options for NTPs and private providers on how they can work together with government institutions in order to make sure that existing programs are making more TB sensitive and so more inclusive and responsive for people with TB. And this is happens through enhancing, action like advocating for the better inclusion of patients, raising awareness and knowledge, engaging with the social protection sector if it's the NTP, expanding the coverage of social protection among people affected by TB by negotiating the eligibility criteria, expanding the definition of who is eligible, and promoting income support for people with TB. And the second task for NTPs and private providers is to strengthen the effectiveness and coverage of TB-specific programs. There are programs that are specifically given and delivered to people affected by TB. And this happens by extending the benefit to all people affected by TB, not just those with multi-drug resistant TB, by ensuring that the benefits provided are adequate to meet the needs of these people, and by mitigating the stigmatization that might result from targeting these people with social protection or poverty alleviation strategies. So sometimes there is the perception from the NTPs that whatever has to do with social protection is beyond, outside their remit and scope of work. In fact, this is not the case. They have a huge role to play, and they, through the guidance, will have a better understanding of what is the task, the type of activities that they might invest on to strengthen the role of social protection in their response. Over. Thank you for your attention.
Thank you so much, Delia. What an amazing set of speakers we've had. We've heard from the survivors, we've heard from the carers and the providers, and then we heard from the higher level policy makers and WHO. With that, I'd like to open the floor for questions. I know there are some comments in the chat, but if you have a specific question, please indicate with the raise hand option in the reactions at the bottom of your screen, and I will call out. I have three pages that I need to go through, three screens, one, and then go to the second and the third, but please do raise your hand. Okay, I'm going to call Stephen, my dear friend, to talk about his comment very briefly, 30 seconds. What are you trying to say, Stephen? Okay, Stephen is not there. Let's move on. I know there was a question. I do not see any raised hands, but I know that there was a question from one of the GCTA team. Was it Archana or Richa? Do you want to go ahead and unmute
Sure.
and ask the question?
Hi, I want to thank Ernesto and Delia for their comprehensive presentation. I'm just curious to understand a little bit further about how WHO ensures that its policies and guidelines are translated into practice within the countries so that the community can actually benefit from these guidelines and policies. Thank you.
Can I, Leslie, to answer straight away?
Yeah, please go ahead, Ernesto.
Let me be, thank you for your question, which to me is the real question. And let me be blunt. WHO cannot ensure anything to happen in the field because it is not an agency with a mandate to implement or deliver services in the field. WHO is the policy-making body and advises countries and does advocacy and lobby to get countries committing their domestic funding and to get donors putting money to facilitate the implementation. And countries do what they get funded for. If they don't get funded to implement what WHO is recommending, then nothing happens. So at the end, a major player is precisely civil society, who, as it has done in the case of access to medicines and diagnostics, can speak up and say, where is your duty, dear head of government, to protect my human right to social protection? If there is no demand from the civil society, then all the work that an agency like the International Labour Organization and WHO does in producing this guidance and in supporting countries to implement results in nothing. Because in addition, WHO is not funding agency. There is no money that will be flowing from WHO to countries to implement the guidance. And here is when it becomes important as well to demand from Global Fund to support, not in delivering funding for social protection, because it's not within the mandate for them to tackle that part of the response, but to equip the national TB programs with the funding to conduct the planning, the analysis, the coordination, to ensure that the multi-sectorial approach to TB can be realized. So NTPs need to wake up and to realize that they need to exert leadership, convene the other sectors, sit down and say how we are going to ensure that the existing social protection schemes in a country can benefit people with TB. And if there are not schemes that are existing and serving the needs of TB people, then there is need to create some. And to do that, NTPs need to be funded. And these are the little catalyzers of the real change in the way we are responding to the epidemic. Over to Leslie.
Thank you so much, Ernesto. That was a great answer. I'll move to Teresa Mochoge. Please go ahead, unmute and ask your question. And if you want to direct it to a particular person, please mention that as well. Teresa? Teresa, you're still muted if you're there. I see your hand. So since I can't hear Teresa and we have no other hands, if I'm not mistaken. I don't see any hands in all the three sections. Let's try and see if there's if our panel can answer some of these questions. Now, the first question is there a difference in social protection mechanisms between public and private providers. You know, we talked about the NTPs, both Delia and Ernesto talked about, but is it different in the private sector? Should it be different? And if it is, why and how? And how can we ensure that people seeking care get the highest quality care? Who would like to answer that? What about our care providers, Prabha, Devabrata, or Akshan? Would any
Yeah.
of you like to answer? Briefly, very briefly, Prabha.
Yeah. See, where the gateway could be either public sector or the private sector. Number one is the person who's living with the disease, a TB patient. But yes, as far as, but I have a feeling that irrespective of the fact whether they're from whichever sector, there should be no compromise in the quality of care. It has to be given, there has to be justice done to both of them. And probably here there is an extra expenditure that is incurred by the person, patient in the private sector, that he has to pay the private provider for the consultancy fees also. So taking that into consideration, actually, personally, I feel both of them should get the best of services.
Thank you, Prabha.
Okay, if I can add.
Yeah,
Can
sure.
I add?
Go ahead. Yeah, sure. Go ahead, Bouquet.
Okay, thank you very much. There are mechanisms offered by providers often have an access to government funding programs and resources, which this can include subsidized treatment. So this can go a long way, and social welfare benefits. And this form of community-based support services can also be incorporated into their deliveries. We have more offers from personalized, tailored support, such as counseling, because for me, I didn't like the fact that I didn't get the counseling before my treatment and even after my treatment. So I was just on my own. But based on progress being made over time, I think this is well considered. Thank you so much.
Thank you very much for that. I see a question from Ellen on the chat. Would you like to ask Ernesto and Delia the question, or would you like me to read it out?
Hi.
Ellen, go ahead. You're there.
Hi. Hi, everyone. Thank you so much. So I'm a huge fan of this work, and I often get really excited when I read the trial data. And then sometimes when I read the more routine data, like when, governments take up the social protection or individual private providers take up the social protection, oftentimes it's difficult to reach the high efficacy from the trials. So I wanted to hear from experts today if they had any thoughts about how we can get to scale, to move, how can we make that gap smaller? Thank you.
Delia, would you like to answer that? I see your hand up already,
Yeah.
so go ahead.
If I may answer, maybe this is a simplistic answer, but probably it explains a lot of the gap that Helen quite rightly sees. I think the reason is that in this moment in time, the coverage of social protection for poor people is extremely low. In the countries and groups where we would like to be more effective and have the highest impact, social protection coverage is very low. On average, in sub-Saharan African countries, the coverage is about 5-6%, which is incredibly low. And the entire world, the average coverage of social protection is about half. That means that every 2 person that is in need of social protection is not covered. That means that this translates into the fact that you have a powerful tool, but it's not used enough to create a collective benefit, a result, an impact that you see at scale. And even when we look at people affected by TB, the biggest problem in implementing social protection for people affected by TB is barriers to access. They are very much similar to the barriers that the general population experience. But in TB, they are exacerbated by the fact that these people are sick, and so sometimes unable to enroll in the system, and sometimes, very often, in fact, are stigmatized. So the gap could be partially reduced if we could work on the reduction of barriers and make sure to be as inclusive as possible, so that to see an amplification of the effect of social protection. And of course, there are other reasons that have to do with the fact that trials are experiments, and they happen in ideal conditions. And of course, this doesn't reflect the reality. But I believe that the biggest limitation at the moment is the fact that we are not succeeding in giving the right coverage, in achieving the right coverage, or the coverage that is enough to see a change.
Thank you, Delia. May I have Leslie complement?
Yes, Ernesto, please go ahead.
Well, thank you to Ellen for this question. And unfortunately, there is not a single intervention or even two that I can propose and present. This is going to be the game changer. From what we have been observing and actively involved in the last 15 years, trying to get social protection into agenda, I would say that there are quite a few things that we have to do at different levels. I mentioned what we need to get civil society waking up and asking that their human right to social protection gets protected. We also need to get inside WHO and inside the Global TB Department, increasing awareness about the importance of this. I can tell you of a program review last year in a high TB burden country in which everything was focused around diagnosis, treatment, and access to medicines, despite having food insecurity of 70% in the whole population. That is a driver of the epidemic and was untouched by the program review. So social protection is not yet in the radar of the vast majority of those who in the field are supporting countries, and it has to be there. So we need to do far more advocacy in that regard. Yeah. But then comes real practical challenges like the one I saw in a high TB burden country, huge country, more than 100 million people, with strong political commitment with the head of state, who was saying, put people on TB with TB on social protection. Then we went to the program review and nothing was happening. Why? Because the database of the social protection system was not linked with the database of the TB program. And getting those systems to be able to speak to each other became a major technical and then political challenge. So I'm giving you examples of things to do at 3 different levels that explain why there is an awful lot of work to get to the scale up that Ellen rightly so is asking for. Over.
Thank you so much, Ernesto. I just want our other speakers, the 3 TB survivors and the 3 care providers, to just give us 30 seconds takeaway message that you want to leave the audience with before we close. Yeah. Carol.
Thank you, Blessy. I feel like when it comes to social protection, effort is being done, but it's not enough. One of the challenges being limited resources. Persons affected by it, they don't have enough resources to help them, cope with the consequences of the disease. For example, when it comes to in my country, DRTB patients without ID cannot be registered for NHIF. This means they have to go back to their pockets to get the money fund to get the medicines. Others don't even have funds, making it challenging to get their stipends. And then when it comes to nutritional support, there's a use of fee of 500 shillings, which they have to pay for them to access. So asking for 500 shillings from someone who is not working, who doesn't have that amount, is quite for them. Sometimes the nutritional support is not present at all, meaning it's enough, meaning it's not enough for everyone. I also finish by saying sometimes because of poverty, caregivers are forced to, to do odd jobs to support the breadwinners, which are going to leave the patient, the TB patient, without someone to support them. So my takeaway point is when it comes to social, support, let's just make the resources available for everyone.
Thank you very much, Carol. Kayuri, your last takeaway for the audience. Very briefly,
Yeah,
please.
yeah, sure. I just wanted to say that you should keep in mind that you are treating people with diseases. Like, you are not treating only diseases. Like, what we are doing is we are treating people who have the problems. Like, we should not only focus on problem. It should be people with the problem, not problem with the people. So all this thing we should keep in mind before we even, because in every other industry it's like people who are with the problems are given more importance. Only in this industry, in this health sector, it is mainly because the people who are with the problem are less informed, and they are not well, like they are not well educated as the person who are providing the service, and
Yeah.
that can be the only reason why they are treated in this way.
Yeah. Yeah.
Yeah.
Thank you. Great point. Yeah. Fugike, just one sentence of what you want to leave with the audience.
Okay. So I would like to
Sorry,
say that,
Kayuri, that was for Funke.
okay.
Thank you.
Okay, thank you very much. You said one sentence. I will try
Yeah.
because we have a lot breeding in us as TB survivors. So funding for me is the major thing now. Funding and empowering TB patients to actively participate in their care and decision making, and also the effort from stakeholders around the countries is very important, because we have a lot to address when it comes to stigma and discrimination and TPT uptakes and all that. There are so important things, so much barriers and gaps that we need to address. And this is very important for us as the TB affected persons. Thank you so much.
Thank you very much. Devabrata, one sentence, last message for the audience. Afshan, maybe you can come in. Devabrata, I'll come back to you.
Thank you, Blessy. Yes, if we really, social support is one of the key ingredient when it comes to the NTB strategy and achieving those goals. And when we say about the public and the private settings, it is different. No, it should be equal at all tiers. And this is my message, because next month when we commemorate the World TB Day, as much as we would be advocating for the NTB, we should be advocating also for the social support, and that is something that's very important. A road less traveled, but one should be advocating more about it. Thank you.
Thank you so much, Afshan. Prabha, you want to say something? One sentence?
Advocacy, amplify the importance. It's a very integral part of the NTB program. One is on social protection. Second is resources are limited but not channelized properly. They should be sustainable. Ensure that the patient gets it on time.
Okay, thank you very much, Prabha. Devabrata? Okay, so I'm not sure if he's able to connect, but I think it's been a great panel and great meeting. Really excited that so many people joined. I've learned a lot. Something that's really caught in my mind is what Kayuri said. Social protection is the foundation on which the TB treatment needs to stand. And if your foundation is not strong, anything you build on it. So that's a fantastic message that you gave, Kayuri. Thank you very much. And Ernesto and Delia, you really brought out the WHO policy, simplified it for us. But also, Ernesto, what you said, WHO cannot implement on the ground because that's not your role. Right? But you also said that you work with civil society, and I think that's important for us. Most of us on this Zoom call are from the civil society, and it really, I think, reaffirms for us the role that we have to play and how much more stronger we need to be in ensuring that the policies coming out of WHO are implementable, are translated to benefit the people on the ground. So we can't work as just individual dots across, but something needs to connect all that if we want to make ending TB a reality in the future. So, and again, another thing, a friend said to me many years ago, he came into the TB thing to work with GCTA and said, why are these people more interested than about the TB bacteria than me? Why aren't they, reaching out to me? They're doing everything for the bacteria, but nothing to me. So I think it's something for us to think about and change the way we look at things. With that, I'm going to hand it back to Petra. Thank you very much, Petra, for giving me the opportunity to moderate such a lively and exciting session. Over to you. Thank you.
I just want to do one big, massive shout out to all the panelists. What a fantastic session. Thank you so very much for all your insightful thoughts, your heart, your passion. It really rang through. And I'm excited for the new guideline that's coming out next month. And thank you so much for sharing, Delia, Ernesto. Carol, Funke, and Curie, you have been wonderful. I'm sharing hearts here. And Prabha, Devabrata, and Afshan, Blessy, all of you, thank you for guiding us in this big, important topic. I think we heard us loud and clear. More noise around social protection and social support. Let's pick that topic up. I can see that this is an area that the community is interested in. So we will try and push this message out much wider. My colleague put the link in the chat for any questions that have not been answered, so we can go online to further have this debate. And we will for sure bring this topic back in various other forms. Really good to see everyone. Thank you to the participants.
Petra, sorry.
Oh, yes.
I was going to say, can everyone put their videos on so we can take a picture? Maybe Richa can help with that.
Sure.
Because, I mean, it's amazing to see everyone on screen.
Fantastic to see all your faces, and thank you so much for all your input also in the chat. You have the comments and the depth of thoughts that are in there is definitely something I'm going to save and read back again. And I'll share it also with colleagues around the world. Smiles, people. Look at all of you. Beautiful faces. What a wonderful way to end the week and to start a new weekend. You look gorgeous. I can't believe that you're all there. So wonderful to see you. Thank you all for joining. And thank you for
Thank you
keeping
so
the
much.
camera on.
A big
Thank
thank
you.
you, everyone.
Bye.
Thank you.
Thank
Thanks,
you very
everyone.
much.
Thank you so
Bye-bye.
much. Bye.
Bye.
Thank you.
See you soon
Bye.
again. Bye.
Thank you. Okay, bye.
Bye-bye. Bye-bye. Thank you.
Thank you.